My name is Jillian Stone. I'm going to be Joshua Stone's patient this week, and I give him permission to record me for this video.
Knock. Hi, my name is Josh. I'm going to be a nurse today. I'm here to take a head-to-chest assessment of you. It should take about 10 or 15 minutes, and I'm going to need to ask you a few questions. Is that okay?
Yeah.
Alright, so I'm going to close the curtain. I'm going to wash my hands. And I'm going to take a look at your wristband here. Can you give me your name and date of birth?
Jillian Stone, 9/29 of 89.
Alright, are you in any pain?
No.
Are you allergic to anything?
Uh-uh.
Alright, and my patient looks to be as if there are no signs of acute distress. Can you tell me where you're at today?
I'm at the clinic.
Alright, can you tell me what month it is?
June.
Alright, can you tell me who the president is?
Donald Trump.
Alright, so my patient is alert and orientated ×4 to person, place, time, and situation. I'm going to go ahead and have a seat here.
Okay.
Alright. So, the overall general survey of my patient, their mood and affect is appropriate for the situation. Their behavior is appropriate for the situation. Their facial expression is appropriate. Their speech is clear. They're dressed appropriately, and they have good hygiene. Right. So, taking a look at my patient's head, my patient's head is normal cephalic with symmetrical facial features and the nose midline. Taking a look at my patient's skin, their skin color is appropriate for their race. I see no signs of any lesions, incisions, infestation, or wounds. I'm going to touch your arms here, and then upon palpating the skin, my patient's skin is warm and dry. I'm gonna take a look at your head here. Alright, so looking at my patient's head, they have a thick head of hair, and there looks to be no incisions, wounds, or any infestation there as well. Moving on to my patient's checking the patient's hands. I noticed that the nail beds are pink. There's no signs of clubbing, and the cap refill is within 2 seconds. Alright, now moving on to my patient's eyes. So I have it for in a minute. I noticed that my patient's eyes, the sclera is white, and then I'm going to pull down these to look at your conjunctiva. The conjunctiva is pink. There's no redness. There's no signs of any discharge. I'm going to need to shine my light in your eyes for a brief minute. Alright. And can you follow the tip of my pen light all the way to the tip of your nose, and then back out with just your eyes, not moving your head? Alright. And back out. And then, can you tell me what that picture over there says?
God bless this home.
Alright, so my patient would be what we consider to be parallel. Her pupils are equal, round, reactive to light, and show accommodations at 4 millimeters. Looking at my patient's ears, I notice no redness, no swelling, no discharge, no piercings in either ear. And then based on my patient's ability to answer my questions and follow my commands, that my patient doesn't have any hearing loss. I'm going to take a look at your nose, if you don't mind. I'm going to would you mind tilting your head back for me? I'll shine my light up here. And then looking at my patient's nose, my patient has no deviated septum, no deformities or asymmetry or inflammation with the nasal turbinates. And then can you take your right hand to your right nostril and close it, and then breathe out. And then same thing with the left one. Take it and do the same. Alright, so my patient's nares are bilaterally patent with no signs of discharge. Moving on to my patient's mouth. Their lips are pink and moist. And can you open up your mouth for me? Alright, my patient's tongue is pink and moist, and I'm going to pull down on your gums here, or your lip, and my patient's gums are pink and moist. Moving on to the neck and heart. In order to check for JBD, you would normally raise the head of the bed to a 45-degree angle and have the patient lay back, and you would ask the patient to turn their head to the left and then to the right, and then you can face me, and you would note no JBD, and then I'm going to check your carotid. Alright, so the carotid pulse is at a 2+, with normal rate and rhythm. I'm going to check your radial pulses. Alright. Alright, and your radial pulses are also at a 2+ with normal rate and rhythm. Alright, I'm going to go ahead and I'm going to auscultate your heart. And when auscultating, you auscultate over bare skin. So your second intercostal space, right sternal border, is your aortic. Your second intercostal space, left sternal border, is your pulmonic. And then your third intercostal space, left sternal border, is your Erb's point. And then fourth intercostal space, left sternal border, is your tricuspid. And can you lift your left breast up for me? And then the fifth intercostal space, mid-clavicular, is your mitral. And then I'm going to go ahead and listen with the bell. This is your aortic. This is your pulmonic. This is your Erb's. This would be your tricuspid. And then can you lift it again for me? And this would be your mitral. Alright, and I heard S1 and S2 throughout. Moving on to my patient's lungs. I noticed that my patient's not using any accessory muscles to breathe. I'm going to go ahead and auscultate the lungs. Once again, you would do this over bare skin. So this would be your right upper. This would be your left upper. Can you lift your right breast? This would be your right lower. And then this would be your left lower. And then go ahead and lift your right arm for me. Alright, so this would be your right upper. This would be your right middle. And this would be your right lower. And then can you turn to your left for me? Alright, so this would be your left upper. This would be your right upper. And then this would be your left lower. And then this would be your right lower. And then this would be your left lower. And this would be your right lower. Right. My patient's breast sounds are clear. Turn the back face me. Alright. So, are you sharing on any pain?
No pain.
Alright. Is there anything that I can get you? Can you know, pillow, blanket?
Nope, I'm comfortable.
Alright, so you sure that, I can't, TV remote, anything?
Nope, I'm okay.
Alright, so I would lower the bed in the slowest position, raise the handrails on the head of the bed all the way to the upright position, lock the bed, hand my patient their call light, thank the patient for their time, thank you, and hand hygiene on the way out.